So thank you all for coming tonight. And thank you for those who are tuning in on Facebook Live. We will try to get your questions on Facebook Live as they come in. I already have one here ready to go. So just over 2 years ago, our party formed government on a platform of real change. So the Prime Minister tasked my colleague, Bill Blair, MP Bill Blair, to consult Canadians to work on the framework, create legislation, implement regulations to legalize and strictly regulate cannabis. So we're doing that. Bill C-45, which has passed the House now and is now in the Senate, is designed to stem organized crime and to keep it out of the hands of, keep cannabis out of the hands of Canadian youth. In conjunction with the Cannabis Act, C-45, our government also introduced legislation to deal with impaired driving. Can everybody hear me? Sometimes I'm accused of not speaking loudly.
We're good.
Yeah, we're good? Good, all right. So you're my test guy way in the back, okay. So in conjunction with the Cannabis Act, our government also introduced legislation to deal with impaired driving. That was C-46. That is also in the Senate, waiting for their deliberations. And this will give police the tools they need to better detect drug-impaired driving. And we already know that too many Canadians drive drunk or stoned, and we need all the tools possible to keep our roads safe. So I'm a member of both the Standing Committee on Justice and Human Rights, as well as the Standing Committee on Health. And I studied both bills in those roles. And Bill was actually involved, of course, all along the way. So we heard from an unprecedented number of witnesses from all parts of Canada, from all walks of life, and from international experiences in legislating and regulating cannabis. So Bill is Parliamentary Secretary for both Justice Ministers and the Health Minister, and is responsible for both pieces of legislation. He has shepherded them through, right from the beginning, through working with the task force, consulting with premiers and attorneys general and so forth right across the country, as well as other jurisdictions. So Bill has had a long career in policing. He served 30 years as a police officer on the Toronto Police Force, followed by 10 years as Chief of Police. So he knows the problems from a street perspective very well. So he spent a career fighting crime and is the best suited for doing this task. So today we're here to hear from you, dispel myths, provide accurate information, and to take your concerns back to Ottawa. So I'm going to thank Bill right away for coming to Coquitlam-Port Coquitlam, and I'll now hand the presentation over to Bill.
Thank you, Ron. And thank you all very much for attending here tonight. I'm always impressed, quite frankly, and I've had the opportunity to do this in my city many, many times, to attend town halls, but in the communities I've attended across the country, to see people who are engaged and concerned about things that are going on in their community and in their country, and I'm very grateful for the time that you give us. I'd like to begin, if I may, with just a bit of a better explanation, perhaps, than it may have been previously available about precisely what it is our government is attempting to respond to. And I think it's really useful if we can begin with some common agreement on some things, even though there may be other things we disagree on. And I think one of the things that we can all agree on is that the current system of cannabis control is not doing a very good job of protecting our kids. And the reason I say that is Canada has the highest rate of cannabis use among its young people of any country in the world. We've done very extensive research and surveys on this matter, and what we've learned is that in Canada, young people between the ages of 15 and 29, more than 20% of them are reporting that they've used cannabis more than once in the past year. That number in our high schools, is already concerning, but that number climbs for kids in grades 11 and 12 up over 35%. And so 1/3 of the kids in high schools in this country report that they're using cannabis. And for adults between the ages of 18 and 24, that number rises to 45%. And so that's a concern to us. It's a concern because there are social and health risks for cannabis use among our kids. And one of the reasons that it is so concerning is that the cannabis they're using, they're purchasing from criminals. The entire 100% of the current market for cannabis in this country is controlled as a criminal enterprise. It is not regulated. It's not subject to any rules. There's no oversight. There's no testing. There's no accountability. And so what is being produced and consumed by Canadian youth and by Canadian adults is potentially unsafe. And in that criminal enterprise, those criminal organizations are making billions of dollars. It's estimated that the value of the criminal market for cannabis production and distribution in this country exceeds $8 to $10 billion a year. And that is money that does not do any public good. Taxes are not paid on it. It's not invested in anything of any social value. And so what we have currently in this country is a system of criminal prohibition for cannabis that is putting our kids at risk and enriching organized crime. So I think that's an important place to start this discussion. Now, if the Government of Canada was only proposing to legalize cannabis, then I think there would be very, very serious concerns with the government's plans. But I want to be very clear about what it is the government is really proposing to do. What the government is proposing to do is implement a system of very comprehensive regulation, regulatory control of production, to make sure that which is being produced to be consumed by Canadians, Canadian adults, is subject to oversight, rules and regulations, testing, recall, that it's a system with accountability built into it, where there is a system of governance and oversight to make sure that people are actually obeying the rules. And so what is produced in a regulated system is of known potency, and known provenance, and known purity. So it's not contaminated with dangerous chemicals. And that for Canadians who choose to consume, Canadian adults who choose to consume this drug, they have an opportunity to consume something which is of known potency, so they know what effect it might have on them. To, frankly, take that business away from organized crime. And through the strict regulation of its distribution, and these are primarily provincial regulations, we have the opportunity to restrict the access that children currently have to this drug. And I'll tell you, when we talk to kids, they will tell us that it is easier for them to acquire cannabis in our society today than it is to acquire alcohol. Because the people that are selling cannabis in our society only care about the profit and don't care about those kids. And so we want to do a better job protecting those children, to restrict their access to this drug by restricting those who sell it to them, and by displacing the criminal market with a well-regulated production and distribution system that will make it safer for all of our citizens. Now, I'm not trying to suggest that everybody involved in this industry is a motorcycle gang member, a street gang member, or an organized criminal. But the entire enterprise is criminal and outside of the law. And we want to make sure that it's properly regulated. And so in order to do that, the reality is you cannot regulate that which is prohibited. And so we propose to lift the prohibition. That's what legalization is. And replace it with a system of strict regulation, which we think will do a better job protecting our kids and keeping our communities safe and protecting the health of Canadians. Now, there's something else that's very important here, because I've talked to parents from across the country, and one of the harms that they're worried about for their kids is the criminalization of their kids. Parents are worried not only that the kid might be involved in this drug, that it represents a health risk to them, and they're worried about who they're hanging around with and whether they're going to be successful in school, but they're also worried about them getting busted by the police and ending up with a criminal record. And that criminal record stays with them forever. And so we're also trying to create a more just society as well, and a more intelligent response to protecting our kids without putting them at risk. And so what we propose is not to enforce the prohibition against our kids for the possession and the use of cannabis with the criminal law, but with provincial regulation, which frankly I will tell you is a much smarter way to deal with this. And as a former police officer, it's exactly how we deal with alcohol. We have an absolute prohibition for young people under the age of majority here at 19 here in British Columbia to purchase, possess, and consume alcohol. But they aren't arrested and criminalized for it. They're given a ticket. So the police can seize it. The police can issue a ticket. It's an offense. It's an enforceable prohibition, but it doesn't result in a criminal record for the kids. And so we want to do exactly the same thing with cannabis because it's the right thing to do, to protect our kids, but not to put them at greater risk from criminalization. And so we've embarked upon a process of building those regulations. And we've done it in consultation. And I want to assure you of this. Ron made reference to it. We had a task force that went across the country. We came out here to British Columbia. I came with them. We've been in this community last year. We've come back to this community a number of times in consultation because hearing from all of you and the concerns that you have been an important part of informing this process about developing regulations. We've now reached an important point of the work that we're doing to make this work. We've been in consultation with municipalities and provinces. Each of the provinces, including British Columbia, of course, are bringing forward their own regulations with respect to their responsibility to oversee and administer the distribution system. And we've been meeting with municipalities across the region about talking about what municipalities must do in order to ensure that there's proper regulation and control of the way and the place in which this might be consumed by adults. And we all agree that we're all working together to do a better job protecting our kids. There's been a very important discussion about resources and revenues. And for example, in my conversations with the police, Ron mentioned earlier that we brought forward legislation to control impaired driving. It's not just simply a matter of passing laws. We have to make sure the police have the tools and the training, the technology, and the resources they need to do their job. And so our government has put substantial amount of resources available, $161 million, to train the police, to buy that equipment, to make sure the police in every part of this country have the resources and the tools they need to keep our roadways safe and to keep us safe. And we've also gone in our discussions with the provinces and municipalities, and most recently established a new taxation framework for the excise taxes, which will now be collected on this drug. And to make sure that a substantial portion of those resources go to local communities, go to local authorities, mayors, town councils, local police officers, fire departments, and others to help them do their job. And so we have now reached, as I've said, an important part of this discussion because there is still a consultation to take place. Frankly, we are absolutely committed in our government. Ron and I have done this together all day today, but we've been doing it for some time. To continue to come out to communities, we want to hear your perspective, your concerns, so that we can answer any questions you may have, but it's not just a matter of coming out here to sell you on what the government's doing. What the government is doing is informed by your questions, informed by your concerns, informed by the issues that you raise. And so I welcome the opportunity this evening, and I'll stop talking now, and give people an opportunity to raise their concerns, to share their perspectives, and any advice that you would give the government as we bring forward regulations to control not only how this will be produced, but how it will be sold in the province of British Columbia, how it will be advertised in packages, and what more we can do, what more we must do to protect our kids and to keep our communities safe. And so I will stop talking at that point, but I'm very happy to answer any questions you may have and to listen carefully to concerns that you may raise. Thanks, Ron.
Okay, thanks, Bill. So please feel free to ask questions. Raise your hand and I'll try to recognize you. When you give the question, I will repeat it back for the benefit of our viewers at home. So you might want to keep it short because I'm not sure I can regurgitate it accurately if it's really a long question. But we're going to start. We have a question already from Mr. Lino Dalagasa. So his question is 3 parts. How will minors be protected below 18 years old? Will the pricing undercut the black market? And he wants to know about law enforcement tools, which I believe Bill has already touched upon, but maybe you'd like to expand a little bit on those.
Yeah, let me be really quick. The government's first priority here is the protection of our kids, protection of their health, also protection of their social outcomes. And in that regard, it's not just simply a matter of bringing in restrictions on their access to the drug, although that's an important part of the regulations we're bringing forward. But we're also investing significantly, nearly $46 million in a public education campaign that's aimed at children, that's aimed at young people to help them make better choices, to give them the information that they need, to give their parents the information they need to have conversations about the drug use with their kids, to give teachers and doctors and other professionals that work with kids information they need so that our young people can be better informed to make safer, healthier choices. And so we are, through our regulations, restricting the access that young people have to that to prevent them having access to a ready supply as they currently do. but we also want to reduce the demand among young people. And we're building on some lessons we learned from tobacco in this regard. And you'll all remember, 15 years ago, we had about 22% of our population was using tobacco. And through public education and strict regulation, there was a time people would actually be, perhaps not in this room, but a room like this, would be smoking cigarettes. And yet, through regulation and a change in societal attitude, and by giving people information to make better decisions, no one would presume to do that here tonight. And if anybody wanted a cigarette, they would leave the room. They would leave the building, and they'd have to stand outside, away from interfering with anyone else's health or safety to do that. And so we want to be able to build on that experience with cannabis, to teach all Canadians, but particularly young people, how to make smarter choices. We want young Canadians to understand the risk that this drug represents to the development of their brain, to their social outcomes, to the choices that they make. And we also want to protect our kids from the threat of criminal sanction, a criminal record, by dealing with this in a more proportional way. And so those are the steps we're taking to protect children. Now, with respect to competing with the black market, we believe that under the licensed production system and the tax regime that we put in place, that the price that will be established, eventually by those responsible for retail of this substance, which is the provinces, will be competitive with the illicit market. The reason I believe that is there are economies of scale in the large-scale production that we've been licensing, which is seeing a very significant reduction in the cost of production. And so what we're trying to do is strike a balance. We want the price sufficiently low to compete with the black market, but sufficiently high so as not to create an incentive for use. Because we're not promoting the use of this drug. We are not encouraging people to use this drug. What we want to do is if for adults who choose to use this drug, we want them to make safer, more healthy choices. And to conduct themselves in a more socially responsible way, respecting the rights of other citizens as well. And so in order to do that, we're trying to create a market that does not create additional users, but competes with the black market, because displacing the black market, taking this business away from criminals, creates an opportunity to actually create public good by reinvesting those revenues in public good, in things like research and treatment and prevention and rehabilitation. And so that's what we believe we can be competitive with the black market. And I've already referenced, we're in constant consultation. I'm a former police chief and former president of the Canadian Association of Chiefs of Police. And so right from the outset, we've talked to the police about what they needed in the way of tools, technology, authority, and training in order to be effective in keeping our communities and roadways safe. And we've been prepared to come and make those investments, not in time as a result of revenue that might be generated from this, but right up front. We've made a commitment of resources right at the front to put those things in place, because starting right is important, making sure that law enforcement has the tools that they need. But it's not just law enforcement. It's public health officials. It's people who work in problematic substance use. It's making sure that the resources are available to municipalities and to the provincial governments so that everybody can do their job to make this work. And I will tell you, for me, this is kind of an interesting and new experience, because as a police officer for nearly 40 years, I can tell you lots of instances where laws were passed and basically just sort of thrown over the fence, and we would get them and, okay, how are we going to deal with this? And we don't have the resources, we don't have the tools, we don't have the training to do it. But we've tried to take that into account this time. We've listened to law enforcement, we've listened to mayors and to city councils, and we've listened to people who work in public health. And we've tried to listen to what they said and to respond appropriately. And I believe that we have done our best, and yet there was still more to do. And that's why even today, we met with your senior police officials, your fire chiefs, your mayors, and with others working in the community, so that we can continue to listen and learn and take that information back to the government so that we can respond appropriately.
Okay, thanks, Bill. Yes?
So, obviously marijuana has an intrinsic relationship with mental health, as predisposition to having predisposition to any mental illness can be exacerbated by the use of cannabis. Is that going to be incorporated into the labeling or education program as well? And then on that same note, because of that relationship with mental health, we already see in the current system where police officers have to take people in mental distress to the hospital because they're because of the triage system in the hospital. They're stuck in line. They're stuck in line for 6 hours. The police officer has to stay with them. Essentially, we're spending a lot of money on police officers to babysit people who really need to be somewhere who's going to treat them more immediately. So I guess that relationship with mental health, I don't
Yeah, I'll speak to the...
Let me see if I can summarize that.
Yeah.
So your concern is that there is a relationship between marijuana and mental health, and has that been considered in this approach? Also, what will happen and how will that affect when police officers encounter someone who's having problems with mental health and perhaps marijuana, and how will they deal with it? Is that fair?
Yeah, because imagine like if people might discover that they have that predisposition when all of a sudden this product is available, and then there might conceivably be like a spike of crises, right?
So you're worried about people who discover a predisposition to these mental health conditions that are triggered by marijuana use.
And also, I want to see them know that this is something they should think about when they pick up that product.
Okay, fair enough, thank you.
Actually, it's a great question. And I'm really glad you asked it, because it gives me an opportunity to explain where we really started on this discussion. In October 2014, the Center of Addiction and Mental Health, which is the largest mental health research facility in the country, and it's actually located in Toronto. I used to do a great deal of work with them in my previous work. They published a research paper recommending a public health framework for cannabis regulation. And they've also published some really interesting things on lower risk cannabis use guidelines, which are really helpful in this discussion. And it really, their focus was a great deal around, and ours has been as well, about dealing with people who self-medicate, who have mental illness. And 1 person in 5 suffers of something within the spectrum of mental health illness over the course of their life. Very many people use psychoactive substances and intoxicants to self-medicate. And so there's a clear correlation between the use of all those substances and people who are, they're both dependency issues, drug use, abuse issues, and mental health. They're quite intertwined. That's been my experience as well, by the way. And as a police officer, I will tell you, it represented about 1/3 of our work. And we responded to over 20,000 calls in my city for people in mental health crisis every year. It's an enormously challenging issue in public safety and in public health in our community. And we recognize the complexity of cannabis use. And so part of our public health training, this comes to answer finally your question, a lot of the public information we're putting out, those lower risk use guidelines, speak to the complexity, that this can make more difficult mental health treatments. And so people who are undergoing mental health support, mental health treatments, there are warnings and restrictions for their use. And one of the things we're trying to do for years, for nearly a century, we've dealt with this substance using the criminal control model, and that has real limitations. And in some respects, it has limited our ability to really make a positive change and protect vulnerable citizens, but it also has kept the medical community out of this important work. And through regulation, through particularly a public health framework for that regulation, we can bring the medical community back into this, and this is where they belong. If you really are committed to reducing all social and health harm, the mental health community has a very significant role to play. And to that end, even in our task force, there was a couple of people in our task force that I think their areas of expertise really speak to this. And I'd name 2 in particular. Dr. Perry Kendall, who is the Chief Public Health Medical Officer of Health here in the province of British Columbia, and one of the most widely respected individuals in public health in the world, served on our task force. And another member of our task force is Dr. Catherine Zahn. And she is the CEO. She's a neurologist, but she's the Chief Executive Officer of the Center of Addiction and Mental Health. And so both of them participated in our task force, and their recommendations informed the government's public policy, addressing a public health framework and a very sincere consideration of the mental health issues that you speak of. And so I think through regulation, this gives us an opportunity to bring that public health lens to the work that we're doing and to improve outcomes for people who are suffering mental illness. There is, by the way, also some evidence of, because cannabis can interfere with the development of the adolescent brain, and if there's a predisposition to schizophrenia and some other mental health diseases among those individuals, cannabis can actually exacerbate that and not just merely complicate treatment, but it also, because it can cause psychosis, can also lead to further complications in that. And that's why taking a medical lens to this is important, not just merely a law enforcement lens. But I really appreciate the question, Steve.
Gentleman in the center.
Thank you. You probably have an idea what the Goldilocks price is for cannabis in order not to encourage consumption, but to, get the black market of it. Can you share that with us? And my second part of my question is, will the federal government be marking up the price of cannabis from what it pays to the suppliers, to the provinces?
Yeah,
Go ahead. So the question is about the Goldilocks crisis.
the sweet spot, just right.
Yeah. So in terms of pricing for cannabis, in order to reduce the impact of the criminal element and to move it away from the black market. So it's price sensitive in that respect. And whether or not the government will be marking up prices from their suppliers.
Yeah, your point's very well taken. There is a spot in pricing, and there's both price and taxation levers. We've purposely set the taxation levels quite low relative to other jurisdictions. We've set what we believe is a very responsible taxation level in order to allow the price to be sufficiently low to be competitive to the criminal market. And at the same time, it is not our intention to make this so inexpensive that it's an incentive for people to use this drug. And so that's the sweet spot. That's the Goldilocks effect I think you referred to. Let me be also very clear. The federal government is not in the supply chain. The federal government has taken responsibility for licensing and regulating the producer, the licensed producer. We're overseeing that system and we're holding them accountable so that they obey the rules. They operate within the parameters that have been established in regulation, that they submit to the testing, that they be accountable to those rules. That's our job, and we're not in the supply chain. And so they will then be supplying a provincial regulator, and in each province there will be a regulatory body, like a cannabis control board, not unlike your liquor control board. And that provincial regulator will then be responsible for administering the supply chain within the provincial jurisdiction. And the federal government is not in that supply chain. And so we are not adding anything to the price. We are overseeing on behalf of both ourselves and the provincial government a harmonized excise tax that we're sharing 75 for them, 25 for us. That through them, then the money will hopefully flow to the municipalities. And there are some cost recoveries that the regulator will have to take into consideration as well. But I think we're all very consistent with, we have two major goals in this program, and there's consensus. If there's anything we agree on in this country, around cannabis, it's that we have to keep this out of the hands of our kids and we want to compete with the criminal market. And both of those considerations take us to a responsible pricing.
Well, what is that sweet spot?
Well, that's a good question, and frankly, you'll hear speculation around $10 a gram, and I don't think we've settled on that. I think that requires, at the time that at the market, and the market it'll vary. But what I think you'll see is a very responsible and competitive pricing structure based on being competitive with the market as it exists at the time that the market comes into play. And so I'm a little bit reluctant to say, so many dollars and so many cents, because frankly, I don't have that information. It would be a guess.
Will that be set by the federal government?
No, sir. It'll be set by the provincial regulator and the market. And we're not telling people what the price of this is. What we are asking everybody is to make sure, let's keep in mind what we're trying to achieve. And we're trying to displace the illicit market. And I think there's great public value in doing that. And so we're all committed to doing that. And in order to do that, you have to be competitive. You don't have to deeply undercut the black market, but you have to offer a competitive price so that consumers will make the easier legal choice.
Chris?
How much is that excise tax?
$1.
$1.
$1 per gram. And if the product that's being sold is worth more than $10 a gram, then it would be 10%. So if there was some high volume concentration of some very special strain or something where the licensed producer had, say it was $20, then it would be $2 bucks. But it's $1 a gram is the excise tax that's been applied.
In addition to GST?
Yeah, well, where the sales taxes exist, and they're not universally applied across the country, but the harmonized sales taxes, or the DSTs will be on top of that. It works out on average, and I have to say average because there's a variance across the country. It works out on average to about 24% taxation. And I would compare that, for example, with Washington State, which uses a 37% taxation level. And so I think it's lower than that, and it's just simply our recognition that, you know, we want to make sure that the new market is competitive with the existing criminal market.
Yeah, I've heard a lot of complaints that the Washington system is a little tax heavy.
Well, and again, we've done some analysis on this, and you know, I would also urge people, think of this as a bit of a process, not merely an event. And we believe this is a very responsible taxation structure to be competitive with the illicit market, but we're also prepared to work with the provincial partners to adapt as it may be required. I think it's you know, everybody's trying to approach this with the same goal in mind. And I think we're in the right place. And I believe in the conversation I've had with the finance ministers that we've done this very responsibly. And even the feedback we've heard from licensed producers and many others with knowledge of the marketplace, that I think there's a growing consensus. This is the right approach and a very responsible approach. But it remains to be seen how effective it is.
So this gentleman, followed by Jerison, followed by Roy, followed by Nancy. Okay, go ahead.
I'm a teacher in the Surrey Schools District. And,
Can you speak up, please?
certainly. I'm a teacher in the Surrey School District. I'm also a citizen of Poco. Brought my son up to here this evening because we've each had some first-hand experiences walking in our neighborhood and with our neighbors. As a teacher, I've had to do confiscations after doing backpack searches, and I know the trouble that students get into and what starts to happen to their learning when they get involved, more and more involved with marijuana. I want to obviously keep my own children away from it. And I'm asking, will there be a buffer zone where children are protected, where they learn, play, and live? So playgrounds, schools,
Yes, sir.
and also residences. I know in Ontario, I'm just learning about what other people are doing to respond. On the Ontario government's website, they are allowing it to be consumed only in a private residence, not on the grounds of the residence. So I'm wondering if the government would support, say, the municipal government in Poco with the laws in that regard. Because I know in our neighborhood, you might have someone smoking marijuana right on the other side of the fence from us. And here in the Lower Mainland, the lots are not as big as you might find in the prairies or other areas. The land is very expensive. So I think I can do a pretty good job of being just with someone. And I've asked this person, hey, you know, I know it's not legal, but could you please smoke on the other side of your property? It's coming over here for my kids. He said, if you don't like it, call the police. And I did. And the problem became worse. So you have these things developing where the police don't even know how to respond. They say, you know, I don't know if we can respond. We're kind of sitting back waiting for the outcome. And in the meantime, this is coming in the backyard where my kids are playing. That's a 10-year-old girl, 14-year-old boy. And I'm not the only one experiencing this.
I had the same problem. Yeah.
All right, so let's see if I can summarize that. So you're concerned about whether there will be buffer zones set up around schools in similar places? And you're concerned about the rules about where cannabis can be consumed and what recourse you might have as a private citizen if it's troublesome to you. Is that correct?
Great, it's my kids, especially.
Okay.
Because they'll come in and say, Dad, smoke marijuana, smoke.
Fair enough.
See the police coming over, and we walk through it. And we don't live in a ghetto. This is a regular family neighborhood up in Poco, right? So you're going for a walk with a dog, and just to offer you an example, a little vignette, see the two little glowing ends, cherry red, about maybe 7, 8 o'clock at night, we're walking our dog down the back alley, and just at that moment, those two people exhale. And so we walked through a big plume, and I said, hey, I stopped and said, could you please do that on your private property? And they said, I am on your private property. And I said, no, you're on public road. The back alley is actually a public road for everyone. And they stepped back and they got a snarky response and said, well, we're on our private property now. I said, well, you know, it's not legal yet. There's just
Let's let Bill answer.
Actually, sir, I take your point. I've heard this in communities and among concerned citizens and parents right across the country. and even in just...
Exact same problem.
What's that?
Exact same problem. The answer was, if you don't like it, move.
Yeah, and so let me talk to that. First of all, I got to tell you, I've heard that type of a concern for decades. You know, not much I can do with bad neighbors. It sounds like you've got a bad neighbor. But having said that, one of the challenges, yeah, I think that's what you got. You got a bad neighbor. And the criminal law isn't a very effective way to deal with a bad neighbor, because you're right, the police are going to come and they're not going to want to go through a major criminal process because the guy's being a jerk. Sounds like he's being a bit of a jerk. One of the opportunities that comes with regulation, though, is that a municipality can, as we have done with tobacco, I already made reference to it, but there was a time when tobacco was used just about everywhere, and we were all exposed to it. You know, and frankly, most of us didn't want to be exposed to it in restaurants and bars and in office places and in the schools and all sorts of places. And so we've been able to regulate that. And we've also been able to change a lot of social attitudes around it, so that people don't do that. As you know, you'll see it occasionally, but mostly we place real restrictions on where people can smoke cigarettes. We need to be able to do exactly the same thing with cannabis, so that that can be controlled. I can't tell you what Port Coquitlam or the British Columbia is going to do, but we'll learn soon enough. But I can tell you what they're doing in Ontario. And my advice to the Premier of Ontario and their government was, as it has been to every province, start very cautiously, very carefully in what you allow in your communities to respond to the type of concerns that you both raise. And so in Ontario, they've placed real restrictions on public space. And it's through provincial regulation that it can't be consumed anywhere other than in a residence. It is very similar to alcohol, by the way. But it places real limits on where this activity can take place. We also recognize landlords, co-op buildings, you know, strata apartments, all must have the ability to control that space and the common areas of residences to maintain the quality of people's lives in those places, because there are unfortunately people in our society who are pretty ignorant about how they engage in their own habits and reckless to the impact that it has on those around them. And so sometimes we have to put rules and regulations in place, but they have to be enforceable rules and regulations. And the situation you currently have, it's a very difficult one for the police, because if you called the police and they came and there's a guy in his yard, their only choice right now is to enforce the criminal law, to invoke a criminal charge of probably simple possession. And when we got to court, if they prosecuted it at all, there'd be very little consequences for that. And it would not improve the situation, it might exacerbate it. Whereas with regulation, and there's actually some value in regulation, in my opinion. It's not weaker, it's more effective law. And we can begin to make very effective changes in our society and in communities like this one on where this activity takes place. And to encourage what I would call socially responsible use. If you're going to use this substance, to do it in a socially responsible way. And I know that sounds a little outside the norm, but we've done this with alcohol, we've done this with tobacco. We don't do it perfectly, but we've done it far more effectively than the criminal law does. And so there are things that communities can do. And I will tell you, I met with your mayors today. And I met with mayor in Surrey, I met with mayors from FCM and from the British Columbia Municipal Association. We've talked a great deal about the important work that they have to do in developing regulations to control where this is consumed. So it's not just a matter of regulation around production and regulation around distribution, but also around consumption. That's what you're talking about. And by the way, sir, like you talk about the schools, let me assure you, like, we want this out of the schools. And it's one of the reasons I'm encouraged that BC has set 19 as the age, the minimum age, because that's usually beyond the high school cohort. Not always, but beyond it. And it's certainly appropriate to have rules that this drug should never be brought into a school. And certainly never consumed anywhere near a school, so that our kids are not exposed to it. I think that's really important. Rules can be, and will be put in place to make sure that this is not consumed or available in public spaces or next to a schoolyard or next to a community center. Those are spaces that need to be protected. But I will tell you, because I've been in the law enforcement business long before I was in the political business, that if you want to enforce regulations and rules, then you have to use proportionate laws. And the criminal charge is disproportionate to that offense. It's a real offense. It's offensive to you, obviously. And I accept and respect your perspective on that, absolutely. But then law enforcement needs to have an appropriate and proportional tool to deal with that. And we believe that's possible through regulation. And part of it's public education as well. We need to inform people about how to do this in a more appropriate way. Because right now, it's lawless. And it's pretty in your face. But by bringing it within a regulated regime, I think we have at least the opportunity to do better. Thank you for your point.
Cheers.
Okay, so I know like when you like drive and you drink alcohol and you get caught, the penalty begins at like 0.5. So when will the penalties begin with like when you, let's say, drive after you smoke marijuana?
Yeah, those are called I'm sorry.
That's right. And so Jerrison's question is about per se limits. What will be the per se limits for marijuana, for cannabis?
The consequences begin at 2 nanograms per milliliter. I know most people aren't familiar with those numbers, but it's a discernible level of tetrahydrocannabinol, THC, which is the drug that impairs in cannabis. That at 2 nanograms, there are legal consequences. It's a summary conviction offense with a $1,000 fine. At 5 nanograms, there is another criminal offense, which is a more serious offense with a much higher penalty. We've added a 3rd offense because what we found is that a lot of people use cannabis and alcohol. And so in combination, this is a really dangerous combination. And so there's an offense for 2 nanograms and 0.5 alcohol, which is another criminal offense. And then as you already, I think, are aware, in British Columbia, they've got a really smart system of license control for people who are at 0.5. The criminal law is at 0.8 for alcohol. But here in British Columbia, they've got a system where if you're at 0.5, you can have your license suspended, your car gets towed, you get an administrative fine. It's a really smart system. And using the new devices that we're making available to law enforcement for oral fluid testing, they'll be able to take the same information from those kids and apply it to the licensing, so anybody who has a discernible level of cannabis in their system which would impair them, then the police will be able to suspend their license, administer a fine, tow the car, precisely as they do with alcohol. That has a huge impact on road safety. It has really made the roads in British Columbia safer. We believe that those alcohol, those drug readings on those drug test kits can achieve the same thing. And I will also just say, if almost a 1/3 of adults, young adults in British Columbia are using cannabis, we have an impaired problem today. It's not created by new legislation. It's a problem today. And so we're giving the authority, the technology, and the training that law enforcement needs today to make our roadways safer. Thank you.
Thanks, Jerrison. Roy?
Has there been any thought given to what all those criminals that are living off cannabis and other drug cultivation, what are those, if you are successful with your new system and you take out a large part of the criminal enterprise, what are those people are going to do? I've not yet once heard what are those people are going to do. They make a ton of money right now, all tax-free, they have lavish lifestyles, they are happy-go-lucky. But do you think they are going out and getting a forklift driver's license and work as a forklift driver, or they are going to work as a cook? What are those hardened characters going to do? They have no regard whatsoever for a civilized society. They are the vultures, they are the raptors of society. They don't give a damn whatsoever about anything that's civilized. What are those people are going to do after you shut their current income down? If that's even possible. Okay, they will find ways around it for sure. But what will those people are going to do? Can you please tell me this? I'm dealing with those bastards right now. They are poisoning my child. They are poisoning my air that I have to breathe. And I'm told if I don't like it, to move. Okay, what is done to reward clean and healthy living?
Well, don't move.
Let me summarize that. So you want to know what's going to happen to the criminals whose livelihood has been altered by...
Illegal enterprise. It's not a livelihood, it's an illegal enterprise.
Well, whatever, you want to know what's going to happen to the criminals who are
Yeah.
no longer able to make a living selling cannabis.
Let me tell you, I know a little bit about organized crime. I spent most of my life working on organized crime. I chaired the National Organized Crime Committee for nearly a decade. I worked exclusively dealing with organized drug crime for several years. And so this used to be my business. Before I was a police chief, that's what business I was in. I have no illusions. I am not naive. These people are well entrenched in a criminal enterprise. I agree with you, by the way. It's entirely a criminal enterprise. And they have been making billions of dollars. It is the easiest money they ever made. They don't have to work very hard. There's very little risk of getting caught in consequence.
What are you going to do?
So what are we going to do? All of the criminal laws that currently exist for illegal production, illegal distribution, illegal importation, exportation, will still exist. We're not taking a single one of those laws away from the police. And so they'll be able to continue to do their job and enforce those laws and to lock those criminals up. That's not changing. What is changing is we're taking market away from those people as well. We're competing with them. They make really easy money because they own 100% of the market. And we're taking a lot of that away from them. And I think that's the right thing to do.
Yeah, I understand this, but
where will they go? This was your question.
Yeah.
And where will they go? I will tell you from experience, some of them will go look for other criminal things to do. And the reason they'll do that is because they're criminals. They don't care about the law. They only care about profit. They will break any rule. They will victimize anyone. And so those ones need to go to jail. And the police will still be responsible for that. There are others who, once the easy money is gone, will go and find other more productive ways to do it. They may be criminal, but they may not be criminal. And I also believe that there are lots of people who have been in this business for a while who are not violent and who don't represent a danger to society, and we need to rehabilitate them. We need to help those, because we can't put everybody in jail. You don't arrest your way out of these type of problems. There are some people that need to go to jail, and they will. But there are others that need to be rehabilitated and to be brought back into the legitimate society and legitimate economy. And so that's the work that we do. It doesn't completely, I'm not naive. We will not 100% eliminate organized crime by doing this. But we will take away a great deal of opportunity from it.
I understand.
We will take away easy money.
What are those people going to do? Has any thought been given to what hundreds of thousands of people that are now involved in this in an illegal way, what are they going to do to maintain the lifestyle that they are used to?
Well, they're not going to make hundreds of millions of dollars of easy money. You know, we just had a court case concluded in Toronto earlier today, in which the person was convicted and acknowledged that they were taking in between $15 and $35 million a year in the operation of a single illegal dispensary. So it does give you some idea of the enormous financial impact that this has in our
It still
society.
doesn't answer my question. What is this subject going to do then?
Well, that person was convicted, that person is paying a fine, that person has been put out of business. And so what are they going to do next? Frankly, I don't care what they do as long as they don't break the law. It's not my job to replace those finances for them. They're going to have to find legitimate ways of making a living because we're taking away the opportunity to make easy money in the criminal market. That's what we're doing. And we're going to take them out of the criminal market. And for those who persist, all of the criminal laws are still there. The police can still do investigations, they can still lock these people up. But we're also trying to rehabilitate, because not every one of them is a hardcore organized crime figure. Many of them are just people that got into this money because it was business, because it was easy money. And we need to rehabilitate them and bring them back into the legitimate economy. And because that also has benefits to all of society. And so the hardened criminal, we will deal with as a hardened criminal. The less hardened ones, we will try to reintegrate them back into our society, because that's also the right thing to do.
Okay, thanks, Ryan. Nancy?
Thank you. I have a comment, a clarification, question, and a real question, if I may. So maybe I'll start first with the question. And it's in regards to the sheet, it says under the nursery license, I was wondering if you could explain what does clones mean?
I'm sorry, what is it?
Clones. in regards to the nursery license, it says growers, starting materials. It says cultivate any variety of cannabis. And then the second point, it says produce seeds and seedlings, including clones. So I was just wondering what a clone was.
Okay, so the question is, with regard to the handout,
In regards to the plant, is a clone of a marijuana. That's what I think they're meaning here.
Actually, if I just quickly, most of this is not done in the licensed producers. They don't put a bunch of seeds in the pots. It's done through vegetative reproduction, which means they take cuttings off of an existing plant, and it's actually one of the ways in which they're able to determine, once they have very standardized growing conditions, so that they control light and water humidity, etc. And by using cuttings from an existing plant, you get a great deal of predictability about the potency of various active ingredients within that plant. And so that's the way in which most of the licensed producers do it, through vegetative reproduction. And so there are a number of different ways in which those cuttings are produced. And we're just trying to, in the regulations, encompass all of those different scientific methodologies. It's an agricultural activity of growing these plants, because what we find, if we just put seeds in and leave it up to the natural processes of reproduction, you get variations in the outcome of the subsequent next generation of plant, and the cuttings bring greater predictability to it. So I think that's what it refers to.
Good answer, thank you. And on that, I had another, just a clarification. On this pamphlet here, it talks about the minimum age of 18 to purchase. Is this not, this wouldn't be, 18, so this isn't BC they're speaking about?
Okay, so the question is, in the pamphlet, it specifies minimum age of 18 to purchase. That actually comes from the Cannabis Act. And
Yeah, if I may, we're a cooperative confederation. We have 10 provinces and 3 territories. 3 of the provinces have as their minimum age for purchase and consumption of alcohol at 18. The rest are at 19. And so in recognition of that, in the federal law, we set the minimum at 18 and said no one shall go below it, but every province can have a higher age. And so all of them, including one of the ones that was at 18 for alcohol, has made 19 their age for cannabis. So what I think we're seeing is a growing consensus across much of the country around the age of 19, but the federal prohibition begins at 18. That's where the criminal law kicks in. But again, the most effective way to restrict the access the kids have to this drug and to enforce a prohibition is through provincial regulation. And in British Columbia, that would be 19.
Thank you. And the comment was in regards to the smoke, be it marijuana, be it cigarette smoke. I actually attended Port Coquitlam City Council meeting, and I'm actually delighted that Councillor Brad West is bringing forth a bylaw that's still in the works, and it is actually to prohibit smoking in schools, parks, and around the train station. So I'm sure that would also include cannabis.
Yes.
Because smoke is smoke.
And it should. And it's
With
pretty
bylaws,
straightforward.
cities need to put bylaws for it.
Yes, ma'am. Actually, and Ron, you may want to repeat it. The question could pertain to bylaw regulation around smoking, which includes cannabis smoke in public spaces. And, if you look right across the country, the real leadership in this country around smoking cessation and control of tobacco smoking in public space, it came from municipalities. It isn't done in the criminal law and federal law. It wasn't initially done through provincial regulation. It was done because somebody brought forward a motion at the city council somewhere. That's where the real leadership around this came from. And provinces eventually got on board with it and began passing, provincial regulations that reinforce that. But I'm not surprised at all to hear about that type of leadership at your city council. And I think it's a very responsible approach. And it really is the thing that changes social behavior and makes a better situation for you and your neighborhood. And so I'm very supportive of that type of initiative. That was our experience, by the way, even in a city like Toronto. It was the Toronto City Council that brought forward those health regulations that made the difference.
thank you. This lady here.
So just kind of in the same line of undercutting the black market or eliminating it, it's my understanding that the supply that is going to be available as of like go time is going to fall far below cannabis consumption needs. So I see that different proposed licenses here. What's the strategy in getting these entities, be it big or small, their licenses?
So the question is about undercutting the black market and wanting to know what the effect of the size of the growing operation to affect the price.
Well, I think as well, the real question was whether or not there would be an adequate supply.
Okay.
At the time the market, we go with this.
Yeah, so based on, the report done for the Parliamentary Budget Office.
Yeah, the Parliamentary Budget Officer's report was done 2.5 years ago.
Yeah.
In fairness, and things have changed in time. We have a bit of a challenge in determining and trying to estimate exactly what the Canadian market might be, because unfortunately, organized crime doesn't share a lot of data with us. They got a pretty good idea how much money they're making, but they're not telling us. And so we have to base it on estimates. But we've got, it's an educated guess, a very educated guess, I might suggest. And so we believe, and we also, let's be honest, I'm always trying to be honest, we're not going to have 100% of the market on the first day. Because, old habits die hard. And we're going to try to migrate Canadians into the right way of doing this, but for a while, some will do it the wrong way. And so it depends on how much of the market we can capture at the outset. But in order to make sure that we can address that supply issue, we have so far approved 79 licensed producers in Canada. There are about 190 or so who are in the final stages of review, who I fully anticipate will be getting their licenses in the next few weeks or months. And so we'll get many more licensed producers coming online. I believe the number for British Columbia is somewhere in the neighborhood of 87 in the queue that are very close to the final stages. And so we'll see that building out, that industry will build out, and its capacity will increase. We have also some of the existing license holders are massive, and what we've seen is they've made a huge investment in increasing their capacity. And last March, almost, now 10 months ago, 9 months ago, Health Canada lifted the capacity limits on the existing license holders to allow them, at one time under the medical license regime, which is the only regime that currently exists because we haven't passed the legislation yet, there was a cap on how much they could produce, and we've lifted those caps, and so they've ramped up their production in a significant way. And you can imagine we're in pretty close consultation with them about where they'll be in their ability to supply the newly emerging market when it actually goes live. That's still to be determined, but we're working hard on that. And so I have a fair bit of confidence that those existing licensed producers and the new ones coming on will be able to meet the supply requirements that we'll experience when the new system comes into play. And I think it's really important that we do that because, price has a number of factors, and we talked a little bit about price earlier. There were some questions about how do you maintain a price structure. Price is determined in part by the retailer's decisions around how to set the price, around taxation. But there is, in basic economics, the supply-demand calculation. And if the demand is high and the supply is low, then that can drive the price up. And so we're very mindful of that. We want to make sure other jurisdictions, Nevada in particular, had a real problem at the outset of their market because they didn't have the supply to match it. But Canada has a pretty robust experience with licensed production under the medical regime, and we're building that system out, which gives us a little bit more confidence in our ability to address that than may have existed in other jurisdictions. I hope that answers your question.
Yeah, is that where you see the micro cultivator?
Well, and one of the things that we also, talk about when you're trying to create a new industry, we don't want to necessarily just have these massive producers. We want there to be a place for a smaller producer, small business to participate. And as long as they're able to meet the strict regulatory requirements of health and of safety that we've put in place, because we think those regulations are entirely appropriate to protect the health and safety of our citizens. As long as a producer is able to do that, We want them to be able to participate, whether they're a big business or a small business. And in fact, the vast majority of licenses that have been issued to people with fewer than 100 employees, which are small businesses in this country. And so you'll see reflected in the regulatory regime that we've put forward. We've asked for public input on developing regulations that will allow for the craft producers, they're sometimes referred to it, or the smaller producer, within certain limited parameters on how much they can produce, having appropriate regulations for them as long as we're protecting the health and safety of citizens from whatever they produce.
And can I just one question regarding that? In terms of creating an equal playing field, I've noticed in the proposed regulations, the standard licensed producers don't have a cap on THC potency, whereas the proposed ones for microcultivators do. What's the reasoning behind that?
Well, again, it's proposed. There is, because the current producers are in the medical regime. What we want to avoid is any kind of product on the market which would represent such a high risk that it would be dangerous for consumers. And so there'll be regulatory limits on that. But again, that's a proposal for consultation. Again, we are always trying to err on the side of public safety, public health, public responsibility. And so I think that's really important. But it's consultation, and if the feedback from those potential producers or from the public causes us, to reflect and to review that, we're quite open to that input. That's the whole point of consultation. Like a lot of people think you put out consultation papers, ignore the feedback, and then just publish what you always intended to. But I think our track record shows that we actually listen to people and try to respond to what concerns are raised.
Yeah, thank you. I was just trying to figure out the reasoning behind it.
Yeah, I think the reasoning is simply about, we just don't want to make sure that there isn't cultivars coming on the market where for example, the THC level is so high that it could represent a danger to consumers. And we want to maintain within a healthy framework.
Thank you. Actually, sorry, lady behind.
Sorry,
What you want on
well, I'd
this?
like to thank you both for being here tonight and letting other come speak with you. So, we know on average that there's 46 people that are killed by an impaired driver and about 190 a day. So
I'm sorry, I can't actually hear you very well.
Sorry, I can't speak up. I would say that there's 46 people a day killed by an impaired driver and 190 a day are killed in Canada each day. Is there any particular funding that has been allocated for resources for policing or for healthcare? The two resources that will be called upon in the future. I mean, we look at Colorado when they legalized marijuana, their impaired driving went up by 13%, and Washington State went up by 17%. So are there any funds allocated yet?
So your question is, are there any funds allocated for extra policing, for police services, and for health consequences of presumably larger number of people driving impaired by cannabis?
Actually, those are really important questions, and it was one of the very first things that we turned our mind to address, and when we embarked on this whole initiative. We knew that it was absolutely essential that we create a safe environment on our roadways. We also knew that the problem already exists. And I think you and I have talked about this before. The problem exists today. And it's astounding to me how many Canadians don't recognize or believe that there is a risk. It's, almost a third of Canadians think that this has no effect on their ability to drive. Almost 15% think that it makes them drive better. It's nonsense. And so we've got to improve public understanding about this, which is really important. I would also make the observation, and I'm not disputing that they saw an increase in Colorado and Washington, but that increase coincided with two things. One was a new regime of legalization in their jurisdictions, but it also coincided with, for the first time, they gave the police the training and the tools to detect impaired driving by drugs. And so the police never had the ability to detect this. I'm not surprised that when you give the police the ability to detect it, they'll detect it because it exists. And so, what are we doing about it? We introduced Bill C-46. And Bill C-46 is a new impaired legislation. I believe it's, and this is kind of near and dear to my heart because I spent most of my life with this, and I've worked very closely with victims of, and their families of the tragedy of impaired driving. This new legislation provides new authority, the new use of new technologies, new offenses and penalties to control impaired driving generally, including drugs and alcohol, but specifically about cannabis. It creates new per se limits. Like these are really important things that we're doing. But I think in reference to your specific point about resources, we spoke to the police. They said we need training. We need training as drug recognition experts. We need training in standardized field sobriety testing so that we can detect the people that are driving impaired. And so we agreed. They said they need access to technologies, which is we're in the process of approving. And you know, since 2008, these oral fluids testing kits have been used in Australia. They're currently used all over Europe, in the UK, in Spain, France, Belgium, and other places. But they're not available to Canadian police officers, and so we're making them available. To make sure that they work, we went and tested them in the Canadian environment, 8 different police services, because we wanted to make sure they work in the cold. The Canadian Society for Forensic Scientists have done the scientific work and provided us with the standards to approve those devices, which our Attorney General is in the process of working through right now, so that those things will be approved. And then very importantly, in our conversations with the police, they said, we need the training, we need the authority, we need access to the technologies, but we don't have the resources to do that. And here's the final answer to your question. Our government acknowledged that. We've committed $161 million for the training of police officers, to train those drug recognition experts, to train officers in standardized field sobriety testing, and to train them in the new legislation and the new technologies. We're going to pay for those devices for the first 5 years for police officers right across the country. And the training that they receive, instead of having to go to the United States to receive it, it's going to be done right here in Canada in both official languages. That's a huge step forward. You know. Oh yes, ma'am, we're going like crazy on the thing. And will it all be done on the first day? No. To be honest with you, drug recognition experts have been authorized in law in this country since 2008. But law enforcement was never given the resources. For a decade, we've had that legislation, and we've never had the ability to actually do the work the Canadians need us to do. I apologize for saying us. I mean the police. It used to be us. For me. But you know, I'm not quite finished, because $161 million is important. But we also made a commitment of $46 million for public education around this thing. We've made an additional commitment of many millions of dollars for training and public education around impaired driving. We've also made a significant commitment of resources for the RCMP and CPSA, because we need them to do more work. So we're making those investments to make sure that everybody who's got a job to do has the tools they need to do the job. And it's exactly what communities have told us they wanted. It's what the police said they needed. It's what Mothers Against Drivers said they needed. We listened and we've responded. I got to tell you, it's one of the things I'm proudest of. For all of the work that my government's done on this file, the fact that we not only stepped up with legislation, but we stepped up with the resources to make it work is I think, one of the most important things, the most important commitments that we made. You got to put your money where your mouth is, and in this case, we've done just that.
For those convicted of impaired driving, say causing death, what penalties, if anything, nothing's changed?
Well, you know, there's a lot of different approaches to sentencing on this. The penalty for impaired causing death remains as it has been.
You don't have judges that give out appropriate sentences for impaired driving causing death. On average, it's 2 years or less.
Well, for impaired causing death,
Yes.
in fact, the average is closer to 7 years. I looked at this. The average for impaired causing death is closer to 7 years. That is actually the average, because we looked at it in the context of mandatory minimums for causing death.
Yeah. Sir, I've worked with over a couple of hundred families who have lost their children, and myself included. My daughter was killed 6 years ago.
Yes, ma'am, I know that. You and I have talked about this before.
It's been 2 years. We've seen sentences of 1 day in jail, $1,500 fines, $2,000 fines, 90 days in certain things. And these are for fatalities. So I'm asking you now, you have penalties who say up to 14 years in jail, but if they are not enforced, it makes no difference.
And ma'am, I'll tell you, I spent much of my life in the criminal justice system. I've brought those cases before the court, and I've been responsible for a police service that brought too many of those cases before the courts. I have a great deal of faith in our criminal justice system, and I regret the fact that you clearly have lost some faith in that system. I believe that it is the responsibility of people like myself, in my old job, to collect the evidence, to put it before the courts, so that the courts can make an appropriate decision and determination on what was the right sentence. I believe there is overwhelming consensus in this country, and they're porous, of those who would take someone's life because of the decision to get behind the wheel while impaired. I also believe that it isn't just about punishing after the fact. I don't think anybody should experience the tragedy you experience. And so prevention is really, really important right up front. And I think prevention is a factor of not just consequence, but a certainty of getting caught. And so by getting the tools, the training and the legislation, and the technologies in the hands of the police, in this legislation, mandatory breath screening on roadside, in other jurisdictions, that's reduced impaired death by nearly 25%. It makes it worth doing. And so we're bringing all of these things forward to prevent, to deter, to make safer. Because, frankly, I don't want to have to go knock on somebody's door or have one of my former colleagues knock on somebody's door to give them the tragic news. And I still have faith in the criminal justice system. If we put the right evidence before them, our judges will make the right decision. And if a judge makes the wrong decision, and that's happened, then there's a system of appeal, and it's difficult for victims and families, but there's a system of increasingly competent courts to help us get it right. And getting it right is a significant penalty for those types of horrible crimes. But again, I have a lot of faith in the criminal justice system. Those who lose faith in it want to see all sorts of mandatory minimums. But in my experience, the effect of that is not to make the criminal justice system work better. It can actually slow it up. And nothing is more offensive to a family than to see somebody walk free completely because we couldn't get the trial in on time. And so I really believe, I still have faith in this. Yes, ma'am, and so I still have faith in the system, but I believe in making the system work. And I think part of our responsibility and what we're trying to do through this legislation is prevent and deter those individuals who would drive impaired by drug or alcohol, or a combination of their both, so that we can avoid those accidents. I have to tell you, I'm deeply motivated by your tragedy and so many other tragedies just like it. That's what gets me up every single day and makes me go and do this thing. I think we're doing the right thing, and we may disagree on how to get to that final part, but I know we agree completely on the importance of let's prevent this from happening to anybody else.
Thank you. Gentleman on the end.
Yes, you mentioned in your introduction that the consumption of cannabis in Canada is the #1 country in the world. So what do you think is in that market now? So when is it being legalized? What do you think will happen?
So the question is that in our introductions, it was mentioned that cannabis use was highest in Canada. That's, to clarify, is for youth. So we have the highest we have the highest consumption for youth per capita than any other country in the world. How is this regime going to change that? Is that the question? Fair?
Yes, sir. And a really important question, because that's our #1 public policy goal, is to do a better job protecting our kids. And how we'll measure that is to have fewer of our kids using this drug. And so, how do we get there? We do it, first of all, through regulation. Right now, criminals selling those drugs to our kids. So driving criminals out of that market is a really good important first step. We also want, through regulation, to restrict the access that young people have to it. You know, right now, if a young person wants to buy alcohol, or get alcohol, they have to steal it from their father's liquor cabinet. Or get an older brother or something to go and buy it for them, or go and try to pass themselves off. That's not easy. But if they want cannabis, they just have to go down to the corner. And some criminal will sell it to them. And so changing that, I think, makes it more difficult for the young person to get it. But that's not enough. Restricting their access to it is important, and we're going to do that. But that's not enough. But when you change the system, right now, the only conversation a father can normally have with their kid is, this is illegal, don't do it. It's still going to be illegal. It won't be a criminal offense, but it will still be illegal. But now, because it's a regulated substance, I hope that parents can have a conversation. This is why you shouldn't use this drug. This is the risk that it poses to your health. This is what it can do to you. These are the dangers that you face. And we can have better conversations with our kids. And through some of those regulations that control where you do it and how you do it, and if you do it. of those things can serve to denormalize the use of this drug. You know, in our society, we've normalized the use of alcohol. People have to go for a beer after work, they have wine at dinner. We've normalized in our society the use of alcohol. But we've been able to denormalize the use of tobacco through strict regulation and public education. And I'm hoping that we can do a better job of denormalizing the use of cannabis among our kids through strict regulation and public education. And I've talked to teachers and doctors and parents, and it's difficult to have a conversation about some of these things. Very difficult for a doctor or even a teacher to have, and you've indicated you're a teacher, sir, and you've had this conversation with your students, and I applaud that. But I hope it's easier. It's going to be easier to have this, you know, an honest, forthright conversation with those students, because I'm sure they respect you as their teacher. You know, you're an important voice to them. We hope that you can have, you know, an informed conversation and give them the facts instead of fear. Fear has not been a very effective deterrent. Facts might be better. And so I'm really hopeful that we can denormalize the use of cannabis in our society so our kids can make better decisions for their health and their outcomes. And you know, there are lots of parents who are really socially responsible, with good parents, and they do their best, and a lot of other parents struggle with this. And so we just want, as a society, let's have better conversations about this. Let's get better, more facts, and less fear out around this thing. I think that has a potential to lead us to better decisions for our kids. And I want to be really clear to everybody in this room, it is not the government of Canada's intention to promote the use of this drug. Quite the contrary. We want to, first of all, restrict the access that our kids do. We want to encourage them to make smarter choices about their own health, which means not to use cannabis, certainly not to use it at a young age and not to use it often or at high potency, because those are where the real risks are. And for adults who choose to use this, we want to make sure that they can make informed choices, safer choices, more socially responsible choices, lower risk choices than they currently are forced to make, because ultimately that creates a safer, healthier, more just society. That's our intent. So thanks for playing.
So we're just shy of 50 minutes left. I have 3 people on my list. I'm thinking that's probably what we have time for. Did you have a question, sir?
Yeah,
I'll just put you on the list. So we have 4 people on the list, and we'll see how it goes, okay?
I'll shorten my answers. That'll get moved along a little bit better.
So this lady here is next.
Okay, I'll be very quick. We've got 46 million for education of the kids. We've got 161 million for the police training. I think it's still excellent. I'm into research, so we know that it's a mental health issue with the developing brain. So is there being more money dumped into the research?
Yes, ma'am. The
Just
total.
You can tell me how much?
Yeah, the total federal dollars on this is about 732 million. 430 of that is going to be in health investments. Some of that is to hire new staff and Health Canada to do that oversight and the testing.
Yeah.
But there's a significant, and I can't give you a precise dollar within that envelope.
Okay.
Do you have one?
Okay.
But there's we know.
We need more research.
We definitely need more research.
Yes.
And we've also made a commitment. The Prime Minister stood up in the House of Commons and said, we know that there's revenue from this, and we didn't get into the money for this, for the revenue. This is money that needs to be reinvested in public health and public safety. And that means invested in research, prevention, treatment, and rehabilitation. Not just go into the coffers to pay off whatever, or to do other neat things with. Research, prevention, treatment, and rehabilitation. And that's not just for cannabis, by the way. And this country is facing a drug crisis, and particularly an opioid crisis. And there's not enough rehabilitation beds and treatment beds and detox beds. We need research. We need a lot of work on this thing, so it's for all of those things.
Okay, the other one is product recall. You're calling it a drug. How is it registered with Health Canada? Is it classified as a drug, has a DIN number, or does it have...
No, ma'am, it does not have a DIN number.
No, I didn't think so, but how...
It does not have a drug identification, not the DIN... I'm sorry, I am interrupting because you're supposed to repeat all these questions.
But you're doing such a good job.
So what is it classified
Yeah,
as?
this is frankly, it doesn't fit neatly into the Food and Drug Act or the Natural Health Products regulations or the Controlled Drugs and Substances Act. And that's one of the reasons we've created a Cannabis Act.
Okay.
Is so this will fit. It is, even its use as a medical drug, it's not done by prescription, it's done by a medical authorization, which is different.
Yeah.
And so doctors can authorize its use. but it does not have a drug identification number, which is why it's not sold over a prescription counter and dispensed by a pharmacist. That can only come about if there is an investment in research and if the science supports it. And that's another good reason to
I'm just
encourage
concerned
science.
if there's something that becomes contaminated, they'd have to do a recall.
Yes, ma'am, but under the Cannabis Act, the Health Canada is conducting that oversight and doing the product testing. And if it's found, for example, to contain pesticides, herbicides, fungicides, which are unfit for human consumption, and we've got a long list of those, it is then subject to recall. We're putting in place a seed-to-sale tracking system, so we'll be able to track every gram of that cannabis produced under license, so you can actually do a recall. So that'll be in place.
It'll have lot numbers.
What's that?
It'll have lot.
Well, actually, there'll be a barcoding system that will show that the excise tax has been collected, but it'll also allow us to track seed to sale. And there's a responsible way to do this, and it's not within the prescription drug system. That's another thing. We have to maintain the integrity of that system as well. And so we keep them separate, but we've created a regime of tracking and accountability to protect the health of Canadians. That's Health Canada's kind of stepped into that space. And thank goodness they're there, because right now, the Hells Angels do it. And I don't really love it.
Okay, so we got Chris, the gentleman way at the back, and then this gentleman. So Chris, go ahead.
Will the federal government be requiring LPs to date cannabis when they produce it?
I'm sorry, with the federal...
Date cannabis, just when it's manufactured.
To date it?
Food.
That's a really good question. Frankly, I'm not a pharmacological expert on this thing, and I don't know whether there's a date of expiry, but I think that because there's a seed-to-sale tracking system being put in place, the date of production will be known, and if it is an issue of health.
Well, the quality of cannabis can be great if it turns to CBNs over time. So, and that, some people theorize that it causes anxiety in people.
Listen, if there's a health implication and the science supports that, the system will have the capacity to track the date of production and packaging. And so if that's a relevant factor, and frankly it may well be, I just don't know. That's well over my experience. But if that's an appropriate thing for us to regulate, it'll be possible within this tracking system to determine that.
Thank you. Gentleman up the back.
The new proposed Cannabis Act, according to your chart, it says LPs will not require quality assurance people anymore. And also the storage of marijuana. It says they don't have to follow the security directive in storage, like they levels of vaults and such.
Yeah, it's a conversation that I think it's an important conversation as it's evolved. When the original regulations, the MMPR regulations as they were then called, in 2013 were brought forward for the licensed producers, the licensing of production, it was a prohibited environment. The country was in a prohibited environment. This was an exemption to a prohibition. And so there were really stringent security requirements that were built into the regulations. We've now got about 3.5 years of experience with these things. And quite frankly, there are legitimate questions being asked about how necessary is a bank vault, and it is, by the way, a bank vault, in order to store this in. How necessary is that requirement? There are definitely security requirements for licensed producers that are still quite valid and appropriate and will remain required. But Health Canada, as part of this consultation, is looking at, is all of the original security requirements that we put in place, which was Fort Knox-like security, is it necessary if we're moving out of a prohibited environment into a regulated environment in production? And so it's a very legitimate thing, I think, for Health Canada. You know, we're 3 years into this. We're now stepping into another space in the evolution of the production environment. And to go back and look at, are these security requirements still valid and appropriate in the new environment? And so that's why it's in the consultation. I think it's a really important discussion, and I don't have a final answer for you. All I can tell you is that Health Canada is examining whether or not that level of security is still necessary as this new production environment evolves.
So instead, like if somebody had to build a level 9 vault, they may
And again, I'm a little bit reluctant to speculate on how that could eventually involve too. I will tell you that maintaining security is important because we don't want either diversion of that licensed product going out into the illicit market or illicit cannabis being inverted into the legitimate market. And so maintaining a secure environment is important, but whether it needs to be bank-vault security or some other level of security which may be less onerous and expensive. And so we're looking at that. And part of that discussion as well is back to your point, Liz, about the small craft producer. The security requirements are proven to be onerous and a deterrent for the small participant, the smaller company participant. And we want to make sure that if we are going to have that kind of level, then it should be valid and appropriate. And so it's really worthwhile going back and taking a look to make sure that if we have such a requirement, is it necessary? And if it's not necessary, then let's make sure that we do it right. But if it shouldn't be an unnecessary or inappropriate deterrent from others to participate.
Does that go the same with the quality assurance person? That was so hard to come by.
Yeah, the quality assurance person. There are individuals and individual positions in each of these things. But I think the experience has been, because of the standardized production production environment and the steps that have been taking place, and because of the testing regime that is now being implemented, that quality assurance is being maintained. I also strongly suspect that many of those licensed producers will maintain that position because it's a good business practice.
Thank you. Ms. Tillman?
Yeah, I guess my main concern is through the hour and a half, very little concern is being shown towards the medical cannabis user, and it seems like it's mostly also not directed but talked about in general terms of the kid walking down the alley smoking a doobie as compared to someone who's using it responsibly for what they need. And one of the concerns I have is for a lot of these people, they're screen specific on what they require for their particular medical condition. And when it goes legal, are they going to be able to get that specific screen for what they need it for? And the last thing is, I have a problem trusting Health Canada for quality control, because I've just read in the news about a month ago about there was a recall on marijuana, and it was shown to found chemicals that used to find spider mites that are unacceptable to be used on these plants when it's that close to when you're going to use it. And residue was found on it. It was one of the producers that's licensed to be an organic producer. Health Canada had them off the market for less than a month and back up going. When they clearly, not just when you're using chemicals when you're organic, how can you explain that as being anything except just totally illegal, totally wrong, and yet Health Canada still lets them operate? But yet, we're worried about the guy who may be buying off of someone he's known for 20, 30 years. And, it doesn't make sense to me that we put all this trust in someone that just seems to want to collect money for licenses and doesn't want to do anything to protect us.
All right, so may I respond to your point? First of all, the reason we haven't talked very much about the medical regime, because that's not what I'm talking about tonight. We're talking about a separate system of license for both production and distribution in a non-medical system. The medical regime remains. The medical regime under regulation, those regulations are already in place. They're called the ACMPR regs, and that's already in place. And so that's not what we're talking about. So, and a legitimate point. And by the way, if you want any comment you want to make about the medical regime, it's entirely valid, but it's not what we're talking about here. We are talking about a non-medical system. But having said that, let me just comment on Health Canada.
Does the Cannabis Act not incorporate medical marijuana?
No, the Cannabis Act actually speaks to a comprehensive review of the medical system within 3 years, but it's a separate set of regulations.
But it's all incorporated underneath that.
That's not true. So it's a separate set of regulations. But the ACMPR that's regulated as a result of various court decisions. But that's separate from the Cannabis Act that we're bringing forward. There are certain aspects that are in common, but it's a separate act. And it deals with the non-medical regime for cannabis. But again, let me go back to your point about Health Canada. Health Canada is the only organization that actually tests, that actually has standards. There's a laboratory system, and there's a system of recall. The recall is not because somebody said they were organic and apparently weren't. The recall is based on, there are certain chemicals, fertilizers, fungicides, herbicides, and pesticides, which have been determined through scientific analysis to be unfit for human consumption. And so we test to make sure that those chemicals are not present in something that's going to be consumed by a Canadian. I'm glad that testing takes place, and frankly, so should you be.
If the testing takes place, how did that product get out there when it's labeled organic?
Well, you know what, and if it got tested, and it was found to be not in compliance, then it's subject to recall.
It was already out there. People already
No, that's why we call it recall. It goes out and we call it back. Again, that's the nature of recall. We call the product back. But I would also tell you, when you buy off the guy who you've been buying off for 25 years, I'm sorry, sir, you don't have a clue where that came from, and you sure don't know.
Health Canada does have to do with what's going on at the vaccine.
And I very respectfully disagree with you, sir. That's the whole nature of the regulatory regime, the testing. So, you know, we don't need to debate this. I'm just saying a system for the majority of Canadians, and if it doesn't work for you, that's fine, but for the majority of Canadians, I think it's appropriate. Frankly, the food that you eat, every medication you buy, even the natural health products, are all subject to regulation and testing. And that's done to keep Canadians safe. We have street drugs, any street drug, is not subject to any kind of regulation or testing. And they're not all poison, but they may be unsafe, and you just don't know. And so we think we've got a responsibility as a government to test and have rules in place to protect people. Because if you're going to...
If it's a liquid result, if you're getting a product that's safe at the end of it, then you're doing a great job. If you're not, then you're failing.
Yes, sir. I guess that remains to be seen. But you know, I'm always encouraged when I hear that something's been recalled, because it tells me the system's working. It means somebody's tested that, somebody's found out it was unsafe, and somebody's called it back from the market to protect consumers.